I have spent the last 6 months reviewing over 100 health insurance bills from self-employed and other professional families, and I have found patterns that most people have no idea exist. Patterns that explain why some families are paying $20,000 more than they need to. Today, I'm showing you everything I found. If you're paying for your own health insurance, this might be the most valuable 10 minutes you spend all year. Hi, I'm Rob Riesdorf with American Health Coverage, licensed insurance agent. And over the past several months, I've had the unique opportunity to review detailed insurance costs from dozens and dozens of families. What I found shocked me. Not because people are making bad decisions, but because most people are making decisions based on incomplete information. Here's what I'm covering today. The one calculation that instantly reveals if you're overpaying. 3 patterns I saw in almost every high-cost situation, the alternative options that most people have never heard of, and the exact questions you should ask to know if you're getting good value. This is purely educational, no sales pitch, just data and insights. Let's get into it. Here's a calculation that changed how I think about health insurance. Most people only look at their monthly premium, but your real annual cost is your monthly premium times 12 plus your annual deductible plus estimated out-of-pocket costs. Let me show you why this matters. Let's say you're paying $1,500 a month with a $7,000 deductible, and you spend about $1,500 out of pocket on care throughout the year. Your real annual cost is approximately $25,500. Now ask yourself, in the last 2 years, how much did you actually spend on healthcare? If you're healthy and it was under $5,000, you paid over $20,000 for coverage you didn't really use. That's not a judgment. Most people have never done this calculation, but once you see it, you can't unsee it. All right, so here are the 3 patterns I saw over and over again when reviewing these bills. Pattern number 1, healthy families with high marketplace premiums. The most common situation I encountered. Self-employed families, everyone's generally healthy, paying $1,800 to $3,000 per month on ACA Marketplace plans with deductibles between $8,000 and $13,000. Total annual exposure, $25,000 to $45,000. But when I looked at their actual healthcare usage, most were spending under $3,000 per year on care. They were paying for comprehensive coverage they simply weren't using. Pattern number 2, people who didn't qualify for subsidies. It's another very common situation. Individuals earning $65,000 plus or families earning over $130,000 a year who didn't qualify for government help. They were paying full retail price for marketplace plans, and many had no idea there were other options available to them. Pattern number 3, the income cliff effect. This one was fascinating. I saw several people who earned just slightly too much to qualify for subsidies, sometimes by just a few hundred or a few $1,000s. Their premiums would jump by $400 to $700 per month compared to someone earning just slightly less. Same health, similar situation, but dramatically different costs based purely on income thresholds. Now, none of this is anyone's fault. The ACA Marketplace serves an important purpose. It provides access to coverage for people with pre-existing conditions and subsidies for those who qualify. But if you're healthy and not getting subsidies, it's worth understanding all of your options. So here's what I found when I started exploring alternatives for these families. Private health insurance options exist outside the ACA Marketplace. These are fully licensed insurance products regulated by state insurance departments that have been around for decades. The key difference, they use medical underwriting. That means the insurance company looks at your current health when you apply. If you are healthy, they can offer you significantly lower premiums because they're pricing you based on your individual risk, not the average of the entire population. Here is what I typically saw. Families paying $2,000 to $2,500 per month on the marketplace could often get fixed benefit private plans for $600 to $900 per month. Now, some important context, these are different types of coverage. Private fixed benefit plans focus on major medical events, hospitalizations, surgeries, serious accidents. For routine care, they're often paying out of pocket. But for healthy people, that might only be $1,500 to $3,000 per year. So your total annual cost might go from $30,000 plus on the marketplace to $10,000 to $15,000 with private insurance. Individual results will vary based on age, health, location, and specific coverage needs, but the pattern was consistent. Healthy families not receiving subsidies could often save substantial amounts. Let me show you one real example that illustrates this. I had a self-employed couple, 2 young kids. Everyone was healthy. Their ACA Marketplace plan had a $2,200 monthly premium, an $11,000 family deductible, and their actual healthcare usage was only about $2,500 a year. Their total annual cost was about $37,900. We looked at a private fixed benefit plan. It had a $750 monthly premium. Out of pocket for routine care might run them $2,500 a year. Their total annual cost, about $11,500. That was a difference of $26,400 per year. Now, this is just one specific example. Your situation will be different based on your unique factors, but this illustrates why it's worth exploring if you're in a similar situation. That's real money that could go toward retirement, college savings, or building financial security. Now, let me be very clear about who private health insurance is and isn't right for. Private insurance tends to work well for healthy individuals and families, self-employed or business owners, people who don't qualify for ACA subsidies, and families who rarely hit their deductible. It's typically not the best option for people with serious pre-existing conditions that require ongoing treatment, people who qualify for significant government subsidies, or families with high healthcare utilization. If you have diabetes, heart disease, cancer, or other conditions needing regular, expensive care, the ACA Marketplace is probably your best option. The marketplace can't deny you or charge you more based on health. That's a valuable protection. And if you're receiving substantial subsidies from the government, that's essentially free money. You should take it. My philosophy is simple. Private insurance is a great tool for healthy people in specific situations, but it's not right for everyone. And I only recommend it when it genuinely makes sense for that particular person or family. So if you're watching and wondering whether this might apply to you, here are the questions to ask yourself. Question number 1, am I generally healthy right now? No major ongoing conditions? Not taking expensive medications? Then keep going. Question 2, do I qualify for ACA subsidies? If you are getting significant government help with your premiums, that's probably your best deal. Stay there. Question 3, in the last 2 years, did I hit my deductible? If the answer is no, or only once, you might be paying for coverage you're not fully utilizing. Question 4, what's my annual total cost right now? Do that calculation I showed you earlier. Your monthly premium times 12 plus your deductible plus your out-of-pocket. Get your real number. Question number 5, would I be open to paying out-of-pocket for some routine care if it meant dramatically lowering my premiums? For healthy people, routine care might only be $1,500 to $3,000 per year. If that trade-off makes sense to you, private insurance might be worth exploring. If you answered yes to most of these questions, it's worth at least getting information to make an informed decision. Here's the biggest misconception I encountered. Most people think healthcare.gov is their only option. They have no idea that private health insurance even exists outside the marketplace. That's not their fault. The ACA Marketplace gets massive publicity because it's government run. Private insurance, it's been quietly available the whole time for people who know to look. You're not doing anything wrong by exploring it. You're not gaming the system. You are just using a different insurance product that might be a better fit for your specific situation. Knowledge is power. Now you have that knowledge. All right, so here's what I want you to take away from this video. If you are self-employed, healthy, or simply paying a lot for health insurance every year without using it much, there may be alternatives worth exploring. Private health insurance is not right for everyone, but for healthy people who don't qualify for subsidies, it can potentially save thousands, sometimes even tens of thousands of dollars per year. Here's what to do next. First, do that total cost calculation. Get your real number. Second, ask yourself those 5 questions I just covered. And third, if this sounds like it might apply to you, talk to an independent insurance agent who can show you both marketplace and private options side by side. If you want help with that, I'm at American Health Coverage on Instagram and Facebook. Shoot me a DM or simply comment below. I am a licensed agent. I specialize in this exact situation, and I'd be happy to walk you through your options with absolutely no pressure. Just education and information so you can make the best decision for your family. If this video is helpful, hit that subscribe button and share it with one self-employed friend who might benefit from this information. And also, please drop a comment. Did you know private insurance existed outside the marketplace? I'm really curious how many people are learning of this for the first time. As always, thanks for watching. I'll see you in the next video.